my 6-month supply of toilet roll. What else do I need? Everyone and their nan is talking about it at the moment. Panic buying, self-isolating, and dirty looks at anyone who coughs within a metre of you. Fair to say there's a lot of worry and a lot of confusion. So, coronavirus, what are the facts? So let's start at the beginning. Scientists are looking at whether one of these may have passed the virus onto a human. If you didn't know, it's a pangolin, OBS. Our best guess is that the virus spread from a bat to one of these and then somehow to a human. It spreads from person to person, so things like coughing, sneezing, or having a cheeky snog. The first cases were found in a Chinese city called Wuhan at the end of last year. The World Health Organization called it a pandemic when the number of cases outside China started increasing quickly. So when we talk about coronavirus, we're actually talking about the disease, COVID-19. The big deal about it is that it's new, so nobody has immunity to it yet, and it's likely we won't get a vaccine until next year. There's no cure yet, but scientists are working on treatments.
I'm Chris Smith. I'm also the naked scientist and a consultant virologist at the University of Cambridge.
Okay, so what people need to look out for is the first symptoms of coronavirus. Can you tell us what they are?
Yeah. The majority of people get a fever, so a high temperature. Some of them get a cough, but then as the disease develops, both become more common. So about 88 to 90% of people by the end of this will have a fever. The vast majority will have a dry cough, and then there are some other symptoms. About half of people have a sore throat and a runny nose, and some people have things like diarrhea and vomiting as well.
So quite difficult to tell because it's pretty similar to flu.
Absolutely right. It's almost the same set of symptoms that you get with the whole gambit of infections that are going around at this time of year.
So if someone has coronavirus, how long can they expect to be ill for?
The incubation period is about 5 days, and during that time you won't know that you're ill, obviously, but then the symptoms generally come on. As the symptoms come on, they generally get more intense over about a 3 to 5 day period. About a fifth of people who catch this will have symptoms that go on for longer, and some people will get symptoms that go on for longer and are more severe, others less so. If you're ill for longer, it could be a couple of weeks before you're feeling better.
So the sad reality of this outbreak is that people are dying, and that means real upset that we just can't get away from. From the global data we have so far, we think it's serious for about 1 in 5 people who get it, and it kills about 1 in 100. Who's most vulnerable to coronavirus?
The people who are vulnerable to it and have an additional risk are people who are older. And what we know at the moment is anyone who actually is beyond the age of 40, you start to see your risk increase. Anyone who has a pre-existing health condition is also at higher risk. And that means people who have heart problems, high blood pressure problems, diabetes, kidney disease, and chest problems, including people who've smoked a lot.
About 1/5 of people we think so far have pretty bad experience with it. But how many people are sort of recovering and doing okay?
We only know so far how many people have recovered as a proportion of all the ones we've tested, because you've got to remember that we don't test everybody. So there's probably very large numbers of people actually catching this, and we don't know about them. So we don't really know the accurate answer to that question. But of the people we've tested, more than half have now completely recovered and they're absolutely fine. And there are people in the UK who have had this and have recovered and are absolutely fine.
All this talk about pandemic might make you think you'll definitely get it. That's not the case. And there are easy things you can do to lower your chances. So the main advice is simple. You know when you're about 17 and you told your mum you're going to your mate's house and now you've got to scrub that nightclub stamp off your hand? Yeah, me neither. Anyway, wash your hands really, really thoroughly.
Wash your hands with soap and hot water for the length of time it takes to sing Happy Birthday twice.
Happy birthday to you. Happy birthday to you. Happy birthday, dear Kirsty. Happy birthday to you. Happy birthday to you. Happy birthday to you. Happy birthday, dear Kirsty. Happy birthday to you.
So apart from what you can do, the government have an overall strategy. You can check on 111 online for updates on the government's advice. Generally, if you have even mild symptoms, stay at home. If you start to feel worse, ring 111. A main part of the plan is to keep people as far away from each other as possible. It's called self-isolation. Doesn't mean you go to the other end of the country, probably just your bedroom. It's not only to protect you, but it's to stop you spreading it to other vulnerable people. The idea is that we slow down when the real peak is so the NHS can cope better. For a lot of people, the health impact will be less of a problem than the knock-on effects on our everyday life. So things like schools and unis shutting down, working from home, and trying to get around if public transport's not running properly. We'll just have to deal with these things best we can, but when can we expect to get back to normal life?
Really tricky to say, because what we know is at the moment, everyone's potentially able to catch this. We know that it's spreading very fast because it's a very infectious virus. We know that probably about 4/5 of people in the country this season are going to catch this. Now, how long it then takes to continue rippling on for, we don't know. We're probably going to see a peak in the numbers of cases sometime around about May or June. And obviously, from then on, it doesn't mean it suddenly disappears. It will slowly peter out, but it could be a few months yet.
And how practically will it end? Does it mean we'll all become immune to it, or will we all get it and recover?
I think, based on what we know about this family of viruses, and there are already 4 coronaviruses that infect humans, and they circulate every winter and they cause the common cold. I suspect that this virus will just join the family. And what will happen is that in the future, you'll catch it when you're young, just another cold that we get when we're little. Children we know are having very trivial symptoms with this, so it'll just be a winter cold, and then you'll be immune for life. So I think the long-term consequence for this is going to be that it's something that we pick up when we're young, we become immune to it, we don't get it again, and so the number of older people who are at risk is going to be really vanishingly small. So I think it'll cease to be a really big headache in the future.
Right now I'm in an operating theater that we closed last week and transformed it into a COVID ICU. And this is the second block out of 3 in my hospital. So now we have a general ICU that is clean with no COVID patient. But now we canceled all the elective and non-urgent surgery, and we are using 2 other theaters for COVID patients. So we are expecting a surge in the next days, and we all hope that this surge will not reach the intensity of Lombardy. We are probably 9 to 10 days behind Lombardy. And the intensity that this epidemic reached in the area around Milan was really hit very hard the healthcare system. So many hospitals are nearly collapsing, and the forecast for the next 10 to 15 days is even worse. So this situation changed completely our lives in little more than 1 week. We are working very hard with extraordinary efforts in order to increase our ICU capacity and hospital capacity, with also high dependency units working a lot in order to increase availability for patients. But we are not sure that will be enough. So my suggestion is that you get prepared as soon as you can, because once you start admitting severe ICU patients, it's probably too late for social distancing, isolation, and lockdowns.
Yeah, on that note, Marco, with the measures that have been taken in Italy, almost complete lockdown, like you say, you don't expect that to have a huge effect for you over the next 9 or 10 days?
We all hope that we'll see those effects in little more than 1 week. Probably 10 days, but the next week will not be affected by the lockdown, because this is one of the characteristics of this disease, and especially of the severe cases. So this is an investment for the future, for the second half of March, and it is essential, otherwise we will collapse. But the next few days will not be affected at all by the lockdown implemented a few days ago. So what we know now from the epidemiologists is that a lockdown 24 to 48 hours earlier can have huge consequences 10 to 15 days later.
Marco, tell us a little bit about the people you're seeing coming into ICU there, and what you're seing. Tell us what you see in front of your own eyes.
Yeah, it's true that for 9 people out of 10, they will experience a sort of mild clinical course like a seasonal flu. but for approximately 1 people out of 10, this will be much more severe, requiring oxygen therapy and antiviral specific therapy and hospitalization. And for a large part of those patients, this severity will reach a need for endotracheal intubation and mechanical ventilation for many days. So we are treating those cases. And this means a long journey in the ICU, a long ICU stays, and many days of ventilation and mechanical ventilation, because the respiratory failure is severe, is irreversible, but it takes a lot of resources and a lot of time in order to improve.
We see some of your staff in the background. How are the staff in the hospital there, the San Giovanni Bosco?
We are still opening this block, and we are just admitting now the first patients, and I'm in the clean area. We are really working very hard. We doubled our shifts, and after 10 days, we are already, almost all of us, we are sleep deprived, and that's a problem because we are gonna run a marathon, and we started with a rhythm that we are not sure we'll be able to bear for 1 or 2 months. So, but we cannot do anything else. I mean,
Marco, when you look at, you're obviously and understandably preoccupied with what's happening on the ground in the hospital, in the city, in the region that you are working in. What do you say to other countries around the world?
Yeah, to other countries, I have a lot of contacts with colleagues. I've been contacted by media outlets and colleagues all over the world in the last 4 or 5 days. And I'm trying to spread the word as fast as we can. Get prepared as soon as possible, because the only way to prevent healthcare system collapse is to enforce a lockdown as soon as possible, to increase your ICU capacity and your hospitalization capacity, and to use simulation and to train in using PPEs, personal protective equipment, because it's crucial. Because if a lot of healthcare staff get sick in the first few weeks, then you will not have anybody able to take care of the patients.
Yeah, on that, Marco, have you and your colleagues, the healthcare professionals, are you? I know you said you're sleep deprived. Are you holding up in terms of being infected by this virus yourselves?
Yeah, I have a couple of colleagues who had tested positive last week. So we were tested, and I'm negative now. I have to repeat my test on Tuesday. And I know of colleagues in the red zones in Lombardia where they were overwhelmed by patients that refused to be tested as they were asymptomatic, and they chose to continue to treat infected patients and working with suspect infected colleagues because the workforce is really scarce, and ICU patients need very specialized staff, both clinicians and doctors, and both nurses. Nurses are the real heroes of this epidemic and this emergency.
Yeah. Just finally, Marco, I know you said that you're focusing on trying to expand capacity. You're standing in a room that is now being turned into a ward. Does Italy and your region have that excess capacity to draw on? And how important is it to have those things in place when you're looking at other countries early on?
Yeah. I'm not sure that all regions in Italy will be able to do the same as Lombardy. Lombardy is one of the richest and with the largest leading teaching hospitals, and they are making extraordinary efforts. And also we have the advantage of having them some 10 days ahead of us, so we will take the opportunity to learn from them. We are sharing information very quickly with colleagues. We have daily webinars and networks to share information. We are really making extraordinary efforts because this is an unprecedented situation for all of us. And I hope that other countries, but I cannot predict what will happen in countries with less efficient healthcare systems, and also less abilities to create networks and to collaborate, because we cannot work in a silo. We have to work in a network. Okay, so we have a responsibility for all the patients, not only for the patients that we admit in our specific hospital.
Marco, just finally, when you started on this career journey, I mean, did you ever expect to be in this situation right now? I'm aware you probably have prepared for it very well, but now it's here.
No.
How do you feel?
It's surreal sometimes, and also I think that the lockdown and the emergency sparked a lot of feelings and solidarity, and strengthened a lot of people and characters. We discovered and we realized that we are more probably resilient than we thought just last month. Was prepared to treat so many patients at the same time. So this is
Marco,
unprecedented for us.
Yeah, Marco, thank you so much for taking this time to speak to us. We wish you all the very best, and hopefully speak to you again soon.
Thank you. It's been a pleasure. Thank you.
Dr. Jody Dion Odom is with us, assistant professor, UAB. She's a professor of medicine in the Division of Infectious Diseases. And Dr. Jody, I know you're in high demand, so thanks for taking time to be with us.
I am, no problem. Thanks, Rick and Bubba. Apologies for being late. It's already been a crazy day.
No, look,
it's going to get worse, Doc.
So,
I think you're right.
Well, we're trying to get this proper balance of wisdom, common sense, but not hysteria, frenzy, chaos, and unnecessary fear.
I agree. No, I think that's just the right balance you want to strike.
Yeah, so help us with that. So some of the things we're going to ask you, first of all, have we been able to determine yet, when we're talking about coronavirus or COVID-19, whichever one sounds hipper, that once someone gets it, like some of the other viruses, they are now immune?
I think it's a little early to be sure, but there are some studies that are showing that once you have COVID-19, you have antibodies that protect you from being reinfected. You know, we just started to see this virus in December, so we haven't had a year to know if you can be reinfected after a year. Not enough time has passed. But I just saw a new study where they were looking at a small study in China, and it looked like reinfection was not happening, but sort of stay tuned on that question. We're not sure yet.
Okay, so really not sure, but seeing some promising early indications.
Yeah, most of these viral infections, there are a lot of different flavors, but if you get a certain flavor, like if you get the chocolate ice cream flavor, you don't get infected by that same version again. So it should be the same for COVID-19. We're not positive about that yet.
Doc, if you get this virus, how long should someone expect to be sick? And is the number 80% still holding up, that 80% of the people have fairly mild symptoms?
It is. So to answer the first question, if people have symptoms, they usually have symptoms for about 2 weeks. And most of those are the people with the mild symptoms. Almost everyone has fever, cough, a deep cough, sometimes runny nose, occasionally diarrhea or a little bit of abdominal pain. But fever and respiratory issues are the major symptoms. If you had someone who was really sick and was in the hospital, their symptoms may last longer. So they may be sick for 4 or 6 weeks. But if you're, for the average person who gets this, I think 2 weeks is a good sense of how long it will take to feel better. The first week you usually feel worse than you do during the second week. And in terms of how many people are going to have mild symptoms, yes, the numbers you just gave are the right ones. It looks like about 80% of people will have mild symptoms, about 15% of people will have moderate symptoms, and about 5% are developing severe symptoms.
Do we have any indication that heat or warm weather is going to help us?
So this is $1 million question, and there's a lot of virologists trying to predict based on what we know about other coronaviruses. The coronavirus is an enveloped virus, so we know from other types that the envelope is actually, it doesn't like sunlight, it doesn't like heat, it doesn't like humidity. That's why I don't think that people think it's actually going to totally disappear, but it's possible that the case counts could decrease as it gets warmer and more humid here in Alabama and across the country. It's, again, too early to be sure with this one. This is so new that it could be different than the other viruses have been in the past.
Yeah, be careful because there may be an influx of migration to Louisiana. So just
Doc, let me ask you this. A lot of people are asking. We lose a lot of people in this country every year to the flu.
We do.
Why the panic? Why the scare with this one now? Is it because of the curve of the infection rate or the unknown? Why are we going to such extremes for? And look, every life is precious, okay? But we're in a numbers game.
Right.
We've lost 69 people. Why are we doing this when we lose 20,000 a year to the flu?
Right. I think part of the reason is we understand the flu better. We've had flu every year, some variety of it for many years. So we understand how it's transmitted. We understand how to protect people from it. We have a relatively good vaccine, and we have treatment for people with flu. With COVID-19, we don't have those things yet. We don't have a perfect understanding of the epidemiology. We don't know how easy it is to transmit from people who don't have symptoms yet. And we don't have a vaccine or any treatments for it. They're working on it, but it's going to be some time until we have those ready. I think the comparison with flu makes sense in some ways. Flu is a disease that gives you fever and cough, and it's something that people can understand. But the mortality rate of COVID is much higher. So the mortality of flu is about 0.1%. So when you're talking about 30,000 deaths, that's reflecting the 0.1% mortality. And the mortality rate for COVID-19 is more like 1 to 2%. We don't have the exact number yet, but it's many times higher than the flu mortality is. So that's why we're worried.
And the H1N1 swine flu, we did declare a state of emergency, but it didn't feel like this. And again, same answer. It's because we knew more about that than we do this.
Exactly. Well, I mean, when it first came out, we were still learning, but it was a different. The H1N1 was a different version of the same flu virus that we understood pretty well. So that's why this is different compared to that.
So the big answer is this is new. We don't know much about it, and we may find out when we do know about it. Okay, we can handle it. We can handle it, but the reason why we're taking extreme measures, which I tend to agree with, is because it's unknown, and we're trying to make sure that we don't overwhelm you guys and all the people in the medical industry, so that people can get treatment at a rate we can handle it. I thought it was a great example that the Lieutenant Governor of Texas used. We wouldn't want 10,000 people at a time to break their leg,
right?
Because that would overwhelm us as well.
Doc, let me ask you this on the bigger picture. We've had pandemics before throughout history, and some of them have done, great damage to the population. Mm-hmm. But why this one and why now? Is it just kind of the law of averages? You're going to get one that mutates and gets out, or why are we having this now? Why didn't we have it last year or next year?
Yeah, I mean, in the world of infectious disease, there's always people who are talking about emergency preparedness. And this is the thing that they're always worried about. We know that there's viruses often circulating in other types of, in birds, in bats, in things that come in contact with humans. So from the viral perspective, that's where the virus can be introduced from an animal host into a human host. And as for when it happens, you can't predict when. It can happen anytime. And since we live in a global environment now, there's so many people traveling between borders and taking flights and going to places that they didn't go to 100 years ago, the possibilities for this virus to spread quickly are much worse than they were in the past.
All right, so
that's part of the concern.
Here's the question. I know you're in high demand, but we never got to you giving advice on what people needed to do, and we need to go to a hard break. Is there any way you could talk a few more minutes after this break, or is that impossible?
Yes, no problem. I'm happy to, as much time as you need. I want to answer your question.
Okay, thank you, Doc. So when we come back, now we're going to talk about day-to-day life. As we're continuing to do the research, you guys are doing your job.
You give us some great info about
what all we need to be doing in our everyday lives during this state of emergency and the pandemic. So we'll cover that when we get back. So all of you kind of be ready to take that information. And again, calm is part of this. Just common sense wisdom, and we'll get through this like we have others in the past. This one we don't know as much about as she has made clear, and that's the reason why we're taking extreme measures, because if you don't know something, it's better to over-prepare than under-prepare, and that's all right. So bottom of the hour, we'll talk more right after this with Dr. Jody Dion Odom.
Rick and Bubba, Rick and Bubba.
And we'll get to some of the questions about the misinformation. But since we won't get to the end of the break again and never get to this, let's talk about quickly, Professor, about the people right now that are saying, all right, we're getting out of big groups, we're staying in our homes if as much as we can. What are the things that we need to be doing while all of the people in the medical field continue to try to find answers and get us the information? In the meantime, we all should be doing what?
I think the way you should think about this is that we know we have cases here in Alabama and every state, that there's a single state that doesn't have cases. So assume that this is in your community and take measures to protect yourself and protect your family. Really, the people who are most at risk are anyone above 60 and people with underlying medical conditions. We really want to try to prevent those people in our community and our families from coming in contact with this virus. So that means not being around anyone who's sick, not going in public places where you could come in contact with someone who you don't know has COVID and then bring it back to your house or the people that you love. That's what you want to prevent.
So the hand washing also, right? Hand washing is big.
Yeah, hand washing, use any surface that you're touching frequently, like your phone, like your remote control. You want to make sure that you sanitize those. Hand washing and not touching your face are the two principles right now of not getting coronavirus. But avoiding sick people is probably the even more important step.
We've decided touching our face is out because every time I hear somebody say, don't touch your face, my eyes start itching.
I can't stop doing it.
I have to say, it is almost impossible not to touch your face. I think that you're right.
It's like somebody yawning in the room.
I know. But if you remind yourself as you're doing it not to do it as often, that will help. The reason touching your face is important is because this is a droplet virus that lives on the table. So if you touch the table, you have the virus on your hand, and the way it gets to you is from you touching your eye, then it gets in through your eye. So that's why it's important, but it's hard to put in action.
My wife and I, we had the invisible fence, for our dogs, so we put those on each other. And every time one of us touches our face, we shock each other.
Anything to help.
Perfect.
And it is working.
Dr. Jody, let me ask you this too, because we're getting a lot of questions about this. Is this a natural progression of a virus that is mutating? There's rumors out there that it has been edited, that it could be weaponized. What medically do we know about it right now?
So viruses are always changing. That's what viruses do and how they spread. But there's no weaponization of this virus. This is a virus that we think was living in bats or living in these animals called pangolins in China. And some people in a market where they sell dead and live animals came in contact with the virus and it started to infect humans. So there's no weaponization. If you're hearing those rumors are not true.
Including, which is your field of expertise, including HIV being part of it, that somehow we found some connection that someone had added, parts of the HIV virus, all that false?
Yeah, the virologists have already done PCR, so that means they've sequenced what this virus is, and none of this virus is the HIV virus. So there's no association. I think maybe some people are hearing that one of the drugs that we're trying to use to treat COVID-19 is also a drug that we use to treat HIV patients. So maybe that's where that concern is coming from. But there's no link at all between COVID and HIV virus.
Dr. Jody, tell us this. From the time that we first heard about this, and it was it was in December.
Yeah.
To now, it takes time to find out what it is, to isolate it, to get a test together, to get a protocol, to read the test.
Yeah.
We hear some people like that this has been a total failure of our politics and our medical community, but it seems to me that this is moving extremely fast considering we had no idea what this was 90 days ago.
I think both of the points are true. I think that we had the virus isolated within 9 days of having the first report from China about what this was when it was made public. So that's incredibly fast. We're working on treatments and vaccines to try to treat this right now, immediately, to start within the next several weeks. That's incredibly fast. I think the problem is, and I'm receiving calls from patients and people in the community too, is that given the level of concern, people with symptoms are looking for testing. They want to know, is COVID in my house? Is COVID in my wife? Is there COVID in my child? And that's where the disconnect has been. Many people looking for testing, and there's just not capacity enough yet in our country for everyone who wants to be tested to be tested. Everyone's working on it, and I think we'll get there. But we're in that in-between period where we don't have as much capacity as we would like.
So let's deal with that, because we don't want to overwhelm what we already have. So will you please clarify on those who need to be tested? Because what we don't want is for people who really have not met the criteria to be tested to bog down the system. Who needs to be tested?
So the focus for people for testing right now should be people who have symptoms. So we're doing testing on the people in the hospital who are the sickest and the people who have pneumonia or breathing problems who are in the hospital in the emergency room, not breathing well. Those are our priorities. Anyone who is not symptomatic, who thinks they maybe came in contact with someone with COVID-19, can self-isolate where they don't come in contact with other people, but they don't need testing right now if they don't have symptoms. So that's going to really help if those people don't go to the emergency room at this point.
Correct. So if I think I've come in contact, how long should I isolate myself without contact with other people?
The normal incubation period for this virus is 5 days. So after 4 to 5 days from when you had contact with that person, you should start to feel symptoms. It is as long as 14 days, though. So what we're recommending is a 14-day isolation period where you don't come in contact, just to watch yourself to see if those symptoms develop.
In our society, how long do you think this is going to go on, Doc? What will it take us to get back to quasi-normal?
Yeah, well, the only thing we can do is look at what's happened in other countries. So you can look at the pattern in China, you can look at the pattern in South Korea, and you can see what their curve looks like. I would say we're looking at a couple of months. This is not going to be done in 5 days or 15 days. We should be prepared for changes to our normal daily routine. We're the middle of March, so at least into the middle of May. And then we'll see if the warming of the temperature has any impact on this virus.
All right, let's talk about day-to-day life. And honestly, because, like, for instance, right now, I'll just tell you straight up, we're hungry, okay? And so normally our routine is we all get to the office and somebody makes a breakfast run and goes and gets breakfast for everyone.
Yep.
And we haven't done that. And sometimes you're going to run out of stuff and you need to go to the grocery store. I mean, you're going to, especially if you're saying 2 months.
Right.
So, the toilet paper craze was a little overdone. I wish everybody had worked together as a community a little better on that and not become hoarders. Let's have enough for everyone. But, which, by the way, this is what socialism looks like when you go to the store and just get what they have. I watched a poor guy walking out with 3 packs of napkins. I said, well, we do what we can. But anyway, so where's the level-headedness on, all right, we want breakfast right now. What should we do, not do? What's the numbers? How do we play the odds in this?
I mean, you have to eat, right? So people are still recommended to go to the grocery store to get food for their family. You want to make sure the person going to the store is not the one who has symptoms, and you want to limit, when you're in the grocery store, any contact with anyone while you're there. So try to touch as few things as possible. If someone is coughing, put yourself far away from them. But in terms of restaurants, a lot of restaurants have great options now for just order and they deliver. So if you can have the food delivered to you, then you don't have to worry about coming in contact with a bunch of people in booths behind you and in front of you who could be sick.
Well, what about the people fixing the food?
It's a good question. So they have been told that if they have symptoms, they shouldn't present to work. That's sort of one of the public health tenets for the employers who run these organizations, is their workers who prepare food shouldn't come to work sick. Every place is going to have a different individual policy. I can't speak to all of them, but you could call them before you order the food and ask what their policy is and base your decision on that. That'd be a reasonable option.
Doc, I guess what I'm saying too, if you digest the virus, will you get it, or does it have to go in your respiratory system? Will stomach acid kill it?
If you're getting hot food that's been prepared, that hot food is the food that's been cooked is going to kill any virus that's on it. The concern is someone who touches it afterwards. So, for example, if they put it in a to-go basket for you, someone holding that basket, if they cough on that basket, you could pick up the basket and get sick. You follow me? It's not the food itself.
I got you, yeah.
It's more the packaging.
So one last thing, then we'll let you go.
Yep.
So we have a story here. And you mentioned this, but I just want to get some details. That we've got about 35 companies and academic institutions, I'm sure you're involved in this, trying to get a vaccine ready. and they said at least 4 have been tested on animals, and they think that they might be ready for human trials in April, but the government is reporting that a patient is going to get an experimental dose today. Is that accurate or not accurate?
So there is the NIH. Dr. Fauci's been doing a lot of press lately, so people may have seen him. He's really a leader in our field of infectious disease. They have advanced quickly the ability to test these vaccines. Fortunately, we had a vaccine that was already in production, so people have been working it already. So that is a really good candidate to start to give to a very small number of people to look at safety and efficacy. And yes, I also heard the report that this vaccine is going to start to be tested very soon. I'm not sure today, but I heard it will be tested very soon.
So who do you think should go get breakfast for us in here?
Well, that's a good question.
Yeah, no. Thank you
I can answer that for you.
Dr. Jody, thank you so much.
No problem. I'm happy to help. Thanks for the question.
Thanks for your expertise and all of you in the medical field. And I'm thankful that we live in a country that still has the level of research available that we have in this country. And appreciate
we're working hard to keep people healthy. We're doing the best we can. It's a stressed system, but thank you for getting the word out.
Yes, ma'am. Thanks for calling us. We'll be back 14 minutes to the top of the hour. Rick and Bubba.
Prime Minister Justin Trudeau also said airlines will ban anyone with coronavirus symptoms from getting off the plane. Only 4 airports in the country will now receive international flights.
This measure will carve out some designated exceptions, including for air crews, diplomats, immediate family members of Canadian citizens, and, at this time, U.S. citizens.
Travelers were scrambling to catch flights home ahead of a U.S.-imposed ban on travel from the UK and Ireland. This went into effect on Monday. U.S. President Donald Trump announced the temporary suspension as a measure to contain the spread of the novel coronavirus. People traveling to the U.S. being screened for the virus faced long lines and massive delays at some major airports.
Well, forget social distancing. We were herded into a pod.
I find it very sad because I've had an amazing trip in Washington, but I've felt it over the last 3 days now, where people have just been withdrawing, and the metro's been vacant, and it's just altogether been a little bit scary.
A Tennessee man who received backlash online after buying thousands of bottles of hand sanitizer and was selling them online has donated the rest of its inventory to charity. The Tennessee Attorney General issued Matt Colvin and his brother a cease and desist letter, saying there was reason to believe they were price gouging. The Attorney General confirmed the hand sanitizer was donated to a local church.
If by my actions anyone was directly impacted and unable to get sanitizer from one of their local stores because I purchased it all, I am truly sorry for that.
境外输入已经成为了国内不少地方疫情防控的。
Imported coronavirus cases involving travelers entering China from abroad have now become the main risk. The foreign ministry said health checks and quarantine measures are being imposed equally to Chinese nationals and foreigners coming into China from overseas. Mainland China reported a drop in coronavirus infections on Sunday, but major cities like Beijing continue to struggle with cases of people coming in from abroad. The message is clear to people all over the world. Stop panic buying and hoarding goods during the coronavirus outbreak. Buying too much means other people may be left without necessities like food, medicine, and toilet paper, which has been flying off the shelves. People have been clearing out stores from France to Jordan to Mexico. Germany has now closed its border with France. The country has also done the same with Austria, Switzerland, Luxembourg, and Denmark. This is to try to curb the spread of coronavirus in Europe, which has become the epicenter of the outbreak, and Germany is seeing a spike in cases. As of Sunday, there were almost 5,000 confirmed cases in Germany. This is a jump of more than 1,000 COVID-19 cases from the day before. The Spanish military looked over the streets of Madrid on Sunday, urging people to abide by the city's lockdown. The country is trying to curb the rapid spread of coronavirus after it saw deaths more than double overnight. People in Spain have been housebound by law since Saturday.